Thank you for staying with us. We want to take a second to talk about vein and vascular care. Varicose veins can leave people feeling self-conscious and in a lot of pain, but our Brandy Williams says there's a solution for the pesky problem.
Well, Ashley, pesky is actually an understatement because for some, varicose veins are super painful. Dr. Bunke is joining us. She is the medical director and vein specialist here at La Jolla Vein Care, and you are going to set the record straight. First of all, tell us what the difference is between spider veins and varicose veins.
Yeah, so that's a good question. People often ask that. Varicose veins are the large, bulging, twisted veins at the surface of the skin. Spider veins are also diseased like varicose veins, but they're much smaller. So they're very thin, thread-like veins, also at the surface of the skin.
And both are pretty common, right?
Right, both are common. 1 in 4 or 5 people have varicose veins. And like you mentioned earlier, they're painful for a lot of people. So the notion that they're cosmetic is often a misconception because for a lot of people, they can cause pain, heaviness, fatigue, swelling, they can form blood clots, and even the skin around the ankle over time can change and it can also break down. I
have women in my family who have varicose veins. They aren't pretty. Are they hereditary? Am I going to get them?
Yes, so there is a hereditary component. So yeah, so if both of your parents had varicose veins, there's a 90% chance that you can get them also. Yeah, and so if you have one parent who has varicose veins, it does increase your risk of having them also. But there are also other things like females tend to have vein problems 3 times more commonly than men, and other types of things. So pregnancy, standing occupations, if you're on your legs all day, you're more likely to develop vein problems.
And what's the best way to prevent them?
So that's a good question. So there are things that we think that we can do, lifestyle modifications that may delay their progression, but we're really not sure. So we do recommend active lifestyle, elevating your legs when you can, if you're sitting for long periods of time. And then if you have a standing occupation, then wearing compression stockings is very helpful.
Let's talk a little bit more about the treatment. How invasive is it? Is it painful?
Yeah, so vein treatments have come a long way. Over the past 20 years, newer treatments have been introduced. So most treatments are non-surgical for either varicose veins or spider veins. Most of the time, they're not painful. They can be tolerated really well, and they're all performed in the office, while you're awake.
And how many treatments do you have to have until we see results?
So the treatment plan is tailored to the individual.
Okay.
So, and it starts with the ultrasound exam. We want to know what's going on beneath the surface of the skin, what's not visible to the naked eye. Because a lot of times when you see some spider veins or varicose vein, it's kind of like the tip of the iceberg. There's something going on beneath the surface that we can't see, and it's all treatable. So that's the good thing. And the treatments are common and they're fairly easy for most patients. Spider veins can be treated easily either with sclerotherapy or with laser. The underlying vein conditions for larger varicose veins, those are a little bit more involved, but again, they can be treated with endovenous techniques like endovenous laser, endovenous radiofrequency, and also with foam injections. So we can inject a foam medication into the large bulging varicose veins that'll cause them to shrink and dissolve and gradually disappear.
And I know you guys have been here for 12 years, but you're making some changes. You're branching out.
Yeah, so really exciting news for us and our patients who often drive long distances to come see us. Now we can go see them. So we do have a location in Poway, Chula Vista, and Vista, and so it's really convenient for patients.
Yeah, you have all of San Diego County covered. Amazing. Well, this has been super informative. Thank you so much, Dr. Bunke. I appreciate your time today. If you guys want some more information on La Jolla Vein Care, just visit our website.
Hey, Kelsey of Rejuva Health here, and I'm so excited. Today we have with us Dr. Bunke, physician and vein specialist of the La Jolla Vein Care Center, which is her practice, and she's going to share with us some of her knowledge and expertise as it relates to compression. Thanks so much for being here, Dr. Bunke.
Thanks, Kelsey. Thanks for having me.
So, some of the most common questions I hear are in relation to not only what compression is about, but who should be using it and how they should be using it. So, my first question for you is, in general, day to day, is there a certain group that could benefit most from something like compression?
Well, really everyone can benefit from compression. What we see on a daily basis are patients who have varicose veins, women who are pregnant, during their pregnancy develop varicose veins. So we use it in daily practice as a treatment for vein conditions and also for preventative measures for vein conditions as well. In general, anyone who has a standing occupation, sitting occupation, so for example, someone who sits at an office desk all day long, people in retail who stand on their feet all day, flight attendants, teachers. We have lots of we see this type of occupation quite frequently in our practice. And then also people could benefit from wearing compression to reduce the risk of blood clots. For example, on flights, we always recommend to wear compression stockings on long haul flights.
You mentioned that one of the biggest myths that you encounter is that compression is going to cut off your circulation by it being tight, especially behind your knee. Can you tell us a little bit about that? Is that the truth? What should we look out for?
Yeah, so medical grade compression improves circulation. It doesn't cut off circulation. So people often ask that. They say, is compression going to cut off my circulation? They feel tight. They feel like they're cutting off my circulation. So it's important to make sure that what you're wearing is medical grade gradient compression. So with the gradient, what the gradient is, it gathers compression. It makes compression the tightest around the ankle, and it gradually eases as you move up. So because of that, it gets the blood flowing in the upright direction. So what people are concerned about is if they have compression socks that perhaps there's one gradient. There's not a different a gradient of compression. So certainly that can be counterproductive.
So based on this information, as long as this patient's purchasing a garment from one of the brands you've recommended that has this graduated compression, they have nothing to worry about, correct?
Right, graduated compression is beneficial.
So another question we hear often is, what's the difference between compression socks and stockings and TED hose that you might get in the hospital? Can you explain the differences between those to us?
Absolutely. So they're completely different. So TED hose, if you're not sure what they are those white stockings, stockings that they usually give you in the hospital if you're laying in the hospital bed, or sometimes you can find them in your local pharmacy. Those are completely different than compression stockings. So TED hose are good only for non-ambulatory patients, meaning patients or people who are bedbound. So what they do is they help prevent blood clots for people who are not moving. However, people who are moving and people who are standing upright, the effects of gravity are so much stronger than they are when you're lying down. So because of that, you need something with a lot more strength and a lot more compression to counteract the effects of gravity. So anyone who's walking, who's moving around in ambulatory should not be wearing TED hose.
So oftentimes when people first hear my story, that I was 21 when I got a blood clot on a plane flight, they assume, oh, you're an anomaly. That's nice. Yes, that is different. I should pay attention for that reason, but I don't have to worry about that. It's not common. Do you see a lot of the anomalies like myself in your practice?
Absolutely, and I don't consider you an anomaly at all. We actually see, since we deal with vein conditions all day long, every day, we see quite frequently young women who develop blood clots, young women and men. There are many circumstances where you can develop blood clots, and in your case, it was flying. We do see several patients who have had blood clots from airplane flights or long car travel, or even in some cases just sitting at your computer desk for too long with not getting up and moving around. So we actually do see that. There's many other conditions that can cause blood clots. Pregnant women and being in the postpartum period, the hormonal changes can certainly increase your risk of blood clots. So for that reason, all pregnant women should wear compression stockings. So we see it in a variety of circumstances.
Do you have any tips along with compression stockings that our viewers could benefit from knowing? One thing I work on doing is drinking more water, getting up and walking around. Would you agree with that? And are there other things you would suggest too?
Absolutely. So you want to keep your legs healthy, you want to keep the blood moving. So you want to increase that circulation. So compression stockings do that externally by providing some external support. Moving around, walking, the calf muscles pumps your deep veins and gets the blood blood moving, staying hydrated. If you're sitting for long periods or on flight, certainly stand up, take breaks, pump your calf muscles, get moving around is certainly a big one.
For more on Dr. Bunke, vein health information, be sure to check out lahoyaveincare.com. And for all your compression needs, be sure to stop by rejuvahealth.com as well as compressrx.com. See you next time.
Good morning, I'm Roy Robertson. This is San Diego Made, San Diego Proud, where we present the innovative organizations which help improve the lives of people in America's finest city. Joining us today, two guests from La Jolla Vein Care Center, Dr. Nisha Bunke, who is a renowned venous disease specialist, and Jessica King, who is a vascular sonographer. I love that title. They're both dedicated to the treatment of vein disorders in their patients, which can be unsightly but also quite painful. And this morning, we'll discuss treatment options at La Jolla Vein Care which give patients relief. And Dr. Bunke, I'm saying, yeah, innovative. This has changed so radically, so completely over the course of the last couple of years. We'll talk about that in just a couple of seconds, but let's talk about the disorders that you do treat.
Yeah, so first I want to mention that vein disorders are common. They affect about 80 million Americans. So that means 1 in 4 or 5 of your viewers suffer from some form of vein disorder. So venous insufficiency is the most common, which is a leaky valve issue, which causes an abnormally enlarged veins that are twisted, dilated, bulging. Those are called varicose veins.
And we'll see these like in the exterior.
Yes.
We're going to put up some before and after pictures, and you'll see what it actually looks like before you do the treatment. What are some of the causes behind developing varicose veins?
Yeah, so most of the time it's genetic. Females get them more frequently than men. So there's hormone influences like pregnancy.
Okay.
And people have standing occupations or sitting occupations or more prone to having them.
All right. So that's an awful lot of people that are potentially impacted by this, a wide group. So Jessica, let's talk about how it is that you get into the diagnostic process when people come to La Jolla Vein Care Center. What's the first step that they go through?
Well, veins are deep underneath the surface of the skin, so not typically visible with the naked eye. We use diagnostic ultrasound to assess the veins, take a look at them, and see which veins are working, which ones aren't, the cause of the problem, and the severity. So I do a diagnostic exam, and then the patient will have a clinical exam with a practitioner.
And so some other clinics, they don't treat the underlying causes or get into what's happening below the surface of the skin. Is that right?
Yeah, unfortunately, that's correct. So there's a big misconception with vein problems that it's just a cosmetic issue, which it's not. Most of the time, their presence indicate an underlying problem.
So let's talk about the treatment. What do we do now that's so different from years past? As I say, innovative, because years ago it used to be a really invasive procedure. What about now?
Yeah, so now is the best time to have your veins treated. The technology has really advanced. So in the past it used to be vein stripping surgery. Now we can still get rid of the veins, but we can do it all without surgery. And there's different procedures to do that. So we can do injections and inject a medicine into the vein to cause it to collapse and shrivel up and eventually dissolve. We can also use heat treatments like radio frequency energy or laser energy to heat the vein and dissolve it. So there's many different types of treatments.
That's incredible, and I would think that patients have to be really amazed by the evolution in the way that it can be treated. And some of them may have been, reluctant or thought, hey, I've tried other things, this won't work for me. But there is some relief at hand, right?
That's exactly it. So some people have had vein stripping surgery before, 20 years ago, and they're scared to have it again, or their parent had it, and so they're reluctant. And so they're usually very pleased to find out about the new procedures.
I'll bet. And you can schedule online through the website, right?
You can get all the information online and give us a call.
Okay, so that website is lahoyaveincare.com, and the phone number 858-550-0330. Dr. Nisha Bunke, she, by the way, yes, did write the book on vein care, the Vein Book. Call 858-550-0330 to schedule your appointment. Good morning, I'm Roy Robertson. This is San Diego Made, San Diego Proud, where we present the organizations in our community working to improve the lives of people in America's finest city. With me today is Dr. Nisha Bunke, who's the medical director at La Jolla Vein Care Center. She's a venous disease specialist who uses innovative new treatment techniques to help people with varicose and spider veins. We'll concentrate on spider veins today in a way that's totally different than it's been for previous generations of patients. We'll talk about these new techniques today, and it really is changing. Dr. Bunke, welcome back. Good to see you.
Thanks. Good to see you.
I remember last time you were here, we were talking about 80 million people being affected by varicose and spider veins. Give us the distinction between the two.
Yeah, correct. So they're very common. They're both common disorders. Varicose veins are the larger bulging veins beneath the surface of the skin. They're twisted, tortuous. The spider veins are much smaller. They're very small blood vessels just beneath the surface of the skin.
Okay, so we're seeing the spider veins here. So let's talk about this new therapy. Again, you were here just about a year ago. I don't remember you talking about cryosclerotherapy, and I certainly don't remember me trying to pronounce that. So tell us about this new procedure and what it does. We'll take a look at some video. You're going to see some needles here, but it's important for you to take a look at this.
Correct. So last time we spoke about treatment of underlying vein problems.
Right.
Today we're going to speak about the surface treatment of these spider veins. So traditionally, sclerotherapy it's the gold standard for spider vein treatment. We use a small needle and inject a medicine into the vein that causes it to collapse and gradually fade away over time. Traditional sclerotherapy can be uncomfortable because of the needle sticks, but what we have that's new is cryosclerotherapy. So that combines traditional sclerotherapy, this treatment, with using a cryo machine that uses puffs a stream of cold air onto the skin that'll anesthetize it so that you actually won't feel the needle stick.
Okay.
So it's painless.
So it's just one step before the needle injection just to make sure that it's kind of deadening the tissue. It's much less painful.
Yes, and at the same time as well. So we blow puffs of cold air while we're doing that procedure that you just saw.
Interesting. As I was saying, there's innovation that's going on in your field all the time. You've also developed this new cream that helps post-procedure. Let's talk about that. Yeah,
so we use Ricova cream after surgery to reduce any bruising, redness, or swelling that usually follows any medical procedures. Ricova is a post-surgery cream that we developed over the past 8 years to help our patients feel better and look better after surgery. After getting feedback from patients and doctors and based on our own clinical findings over the past 8 years, we've developed or created a powerful blend of natural ingredients that help patients recover after vein surgery.
Wow, that's great. And so it used to be that it was only administered by the doctor, but now it's commercially available. It's available through Amazon and through the website ricovacream.com too, right?
Correct, yes. So previously it was just available in doctors' offices, dermatologists, plastic surgeons find it useful after cosmetic procedures and surgeries, but now it's available to the general public.
So overall, we have to look at this evolution through the decades, and we're thinking, okay, this is not what grandma was going through 40 years ago. This is completely innovative and totally changed.
Correct. Vein treatment is much more comfortable than ever before, and especially the recovery is much faster and more tolerable than ever before.
And what about the recurrence? I mean, do we see that the veins aren't coming back just in a second or two, or is this kind of a permanent solution?
Well, vein problems are lifelong, so we can treat the veins that you see being treated. Those are permanently gone, but you will develop new vein problems in the future. So it becomes a maintenance issue.
Find out more by calling La Jolla Vein Care at 858-550-0330 to schedule an appointment.
Well, they may not only be unsightly, but varicose veins can certainly be painful for some people. So what do you do if you're dealing with this condition? Help is here for you this morning. Dr. Nisha Bunke from the La Jolla Vein Care Clinic is here with us this morning. Thank you so much for coming in. We do appreciate it.
Thanks for having me.
Talk about varicose veins for a moment. I know my grandma dealt with this, and it used to break my heart watching her try to cover them up all of the time. There is hope and help for people out there dealing with what can be not only unsightly, but sometimes painful for people.
Right, so varicose veins are a common condition. They affect 1 in 4 or 5 Americans. And what they are, they're those bulging, lumpy veins that are not just unsightly, but they can be painful and they can also cause disability.
And so as far as varicose veins that are literally throbbing from the skin compared to the ones that are flat, is there a difference between the two?
There is. So varicose veins, they're basically what they are. Whenever you see varicose veins, they indicate an underlying problem called venous reflux or venous insufficiency. The smaller flat veins are typically spider veins. So they're a little bit smaller in size, but they're still veins that are not healthy.
Okay, so we're looking at some animation here of the difference between what was likely a normal vein, a healthy vein on the left, and then a diseased vein valve on the right. This can be caused because it's hereditary. What are some of the other causes of this?
Right, so genetics is the main risk factor for developing varicose veins. Most people have a family history of a parent or a grandparent like yourself who had varicose veins. If both parents had varicose veins, you have a 90% chance of developing them yourself. Other risk factors are increasing age. The older we get, the more likely we are to develop varicose veins. Although I have seen varicose veins in teenagers because there is such a strong genetic component. Women are 3 times more likely to develop varicose veins because hormones have a strong influence in the development of varicose veins. Pregnancy is a risk factor itself.
I know that happened to my sister, and she said, these better go away by the time this baby comes out. And they did for her, but sometimes they don't for
right.
other
So
people.
50% of people with varicose veins during pregnancy, they'll resolve within 3 months after pregnancy. The other 50%, you're pretty much stuck with them. Other risk factors are obesity, leg trauma, immobility, and standing occupation. So people who have standing jobs like healthcare workers, teachers, flight attendants are at a higher risk of developing varicose veins.
So what can we do to solve the problem? I know that some people used to wear really thick, tight stockings on their legs in order to keep everything compressed. Is that still an option in order to prevent them?
Yeah, so we still recommend wearing compression socks, especially people who have standing or sitting jobs. The compression socks have evolved, so they're much more stylish, but still therapeutic now. Moving, it's a gravity problem. So if you're standing or sitting for too long of periods of time, you should get up from your desk
Stretch
and
your
walk around,
legs,
stretch your legs.
get the blood flowing, yeah.
Elevate your legs.
As far as some treatments that are available with you guys, I think a lot of people fear surgery when it comes to varicose veins. There are some up-and-coming treatments, some stuff that's already out there that's amazing and no surgery involved.
Yeah, fortunately, there are minimally invasive treatments now for treating most varicose vein conditions. So nobody really needs to have varicose vein stripping surgery anymore. So there's a variety of treatments depending on which veins are affected. There's radio frequency and laser treatments where we put a skinny wire into the vein, deliver either radio frequency or laser energy, and we heat the vein and close it down that way. There's also injections where we can inject a medicine into the vein and it'll cause it to shrink and eventually dissolve. So you can get rid of these veins without having any surgery, without the cutting.
And wear those summertime shorts again. We were seeing some of the pictures right there, and it's remarkable. I mean, going from what looks like to be quite a painful vein to nothing at all.
Yeah, and it's less traumatic, so you can get back to normal activities right away. Minimal pain. Most procedures are done in the office in less than an hour.
Fantastic.
So.
Dr. Bunke, thank you so much for sharing this information with our viewers this morning. LaHoyaVeinCare.com is the website in case you need some more information. Again, that's LaHoyaVeinCare.com. Keep up the good work. Thanks for coming in.
It's my pleasure.
More information, go to our website, san diego6.com. Click on San Diego Living.